designed it and put a barrier in the middle and put some rubble strips and made a pedestrian pathway, the number of deaths have reduced completely, almost eliminated. So if this design changes were factored in from the very beginning, what I began to question is, would my mom be alive right now? And the answer is probably yes.
Hello, and welcome to the Global Health Unfiltered podcast, a podcast about unspoken realities about global health in Africa and the world. I am Desmond Jumbam. Thank you very much for joining us. So about a year ago, while traveling on the busiest highway in Cameroon, I was involved in a very terrible car accident. So we're traveling on the infamous Yaoundé-Douala highway, which connects the economic capital of Douala to the political capital of Yaoundé. So this road is about 200 kilometers, and on a typical day it's occupied by commercial buses, passenger cars, and large trucks that are carrying containers and goods from Douala to various regions of Cameroon and Central Africa. So I was traveling from Yaoundé to Douala in a private car when the accident happened. Our driver was attempting to overtake a truck in front of us, and he lost control of the car, and we went straight into the truck that was coming in the opposite direction. The car was completely damaged and totaled, but luckily no one died as a result of the accident because we're all wearing our seatbelts. I, unfortunately, however, sustained a broken thigh bone. So I had to get multiple surgeries as a result of the road traffic accident that I was involved in. I was operated in Yaoundé. I had a nail put into my thigh bone as a fixation. And unfortunately for me, about 2 months after that first surgery, I realized that I had I had developed a terrible bone infection as a result of the first surgery. So, it seems like the quality of the surgery that I had received in Cameroon was unfortunately not the best. And so there was an additional surgery that I had to do to have the surgery had to be redone, and I had to undergo months of physical therapy, and the treatment continues to this day, 1 year after the surgery. But that's actually, a talk about the quality of surgery that injured patients and other surgical patients gets, in the continent. It's a major issue, but that's the discussion for another day. This podcast, episode is really focused on how can we prevent road traffic accidents from happening. But when I was at the hospital, someone came in and we're having a discussions around, why these accidents happen so often in Cameroon. And it seemed to me that most of these crashes that happen in Cameroon and many parts of Africa could be prevented with better road designs and enforcing things like seatbelt and helmet laws for bikes. For example, the Yaoundé-Douala highway on which I had the accident is a one-lane highway for the most of it, and it does not make it easy for vehicles to pass each other. There are a few other mechanisms that have been put in place to reduce the chances of human error leading to crashes. But these are not enough. There's still a lot more that needs to be done, and it's actually a major issue, right? Because there have been hundreds of car accidents that happen each year on that road. So, for example, between 2018 and 2019, there were over 380 car accidents on that highway alone in Cameroon. And this, unfortunately leads to thousands of deaths and many other injuries each year, just like mine. And again, I was fortunate to have my life spared, but many are not as lucky as I am. So, the issue of road traffic accidents is a major issue globally, right? So the WHO estimates that about 1.3 million people die globally as a result of road traffic accidents. But 93% of those deaths happen in low and middle income countries. But these low and middle income countries only have about 60% of the global number of vehicles on the road. And in fact, 8 out of the 10 countries with the highest deaths from road traffic accidents are in Africa, right? So this is a major issue, but it seems to me that most of these car accidents can be prevented with better road designs, and the enforcement of things like seatbelt and helmet laws that actually already exist in many countries, but they're not enforced. So in this episode, we decided to bring in Etta Madete, who is a Nairobi-based architect and very passionate about designing better roads to save lives. This is a passion that comes out of her own personal experience, which she will talk about. But in this episode, my co-host Ulrich Sidney has a discussion with Etta Madete to better understand this issue of better road designs to save lives and what could be done in the African context. So here is Ulrich and Etta Madete.
We like to hear about your story on why you're passionate about specifically safe roads in Nairobi, Kenya, and Africa. You've written and conducted research on this topic, obviously. You're an architect. And when we hear about architects, the first thing we think about is not necessarily road design. So how did you come about this path of being an architect and designing roads to be safer in Africa and Kenya?
Well, thanks for your question. For me, I'm an architect, so you're taught to sort of look at the world in all its bits and pieces. So when I was much younger, I never used to recognize some of these things. But when you study architecture, you realize that a lot of things have a lot of man-made environments have been built and designed by men or women. And so many of the things that happen in the world are preventable or are designed for. So the space you're in right now, if you look up and down, it's a room that you're in. It's been designed for the purpose that you're currently using it for, whether it's a lounge, it's a dining area, it's an office. It's been designed by somebody to work in that way. When you go and step outside your building or outside your office, you'll find that the roads and the streets, they have been designed to function in a certain way, whether positively or negatively. When you go to the hospital and you're feeling anxious or you're feeling comfortable or you're feeling safe or you're feeling worse off than you came in or better off than you came in, a lot of these things are affected by the spaces that are housing these activities. And so for me, when I did architecture, it wasn't just a sort of means of building more buildings. For me, it was a way to make the buildings that we're in better and safer and more useful and more functional. And many times challenging, do we really need a building at all? I mean, do we just build for the sake of building? I don't think that's good. As well as the spaces in between buildings that are often ignored, the pathways, the roads, the streets. I think they're just as important as the buildings themselves. And for me, when I think about space and I think about design, I think that it has such a massive impact on our well-being, our health, our happiness as human beings. And all of this has been designed for by architects, engineers, and planners. So for me, I see it as a sort of call to action that the built environment should be called to task in all the effects that it has on people. And that's why I built that passion. And once I sort of started seeing architecture in this way, I started questioning a lot of things that I thought I'd never questioned in my past, including how our roads are designed. When I was much younger, my mother passed away from a road accident. And that same road is called the Highway of Death. And it's just a stretch of road that a lot of Kenyans use to go from the city, Nairobi, to Western Kenya, where many of our homes and our ancestral homes are. And it's used so often, and I basically go on it 3 times a year. But this stretch salga has been known for having multiple accidents every single year. And this is a known area, it's a known hotspot. So when in 2019, just a few years ago, they redesigned it and put a barrier in the middle and put some rubble strips and made a pedestrian pathway, the number of deaths have reduced completely, almost eliminated. So if this design changes were factored in from the very beginning, what I began to question is, would my mom be alive right now? And the answer is probably yes. So for me, I realized infrastructure, roads, spaces, hospitals, schools, the design of our homes have a direct impact on our development, our well-being. And that's why I'm passionate about it. I'm not a road designer. I'm an architect. I'm a designer. So I'm taught to think about all the bits and pieces and how they come together. And so for me, I challenge anything that has been designed for human consumption to be better, to be thought through for human use and human consumption.
Absolutely, you did. First of all, obviously, condolences for your mother. What I can say about this is, it is unfortunate that we relate, being all the way across the continent. You know, we have this place in Yaoundé, Cameroon, that's called Carrefour de la Mort, which literally means roundabout of death. We equally have a similar situation where when you're leaving the capital for the western region and the littoral regions, there are a lot of people that obviously, unfortunately, lose their lives on those roads. And people have become comfortable with it. You know, it's really unfortunate. So that is definitely something that it is good to see someone like yourself with your background being interested in finding a solution to this. So based on your expertise, research, what would you say is the magnitude of the problem of road safety in Africa?
Well, in the context of Africa and developing nations, the number of fatalities and road accidents is significantly higher than in developing countries. For example, the World Health Organization has calculated there are about 1.3 million people die in road-related crashes every single year. 1.3 million people every single year. That's usually more than any of the diseases that you can think of. So it's a global health issue. And 90% of these people, of these 1.3 million people, are in developing nations. And I don't think it's a coincidence that the sort of correlation would be that that the policymakers and the people who are in charge of infrastructure, especially at the national level, are not called to task when it comes to road safety measures that are often omitted because of budget running out or changes in regime and political power. And so the problem in the African context is that the changes to make roads safer must come from the top, the macro level budget disseminations and the amount of money allocated to roads and infrastructure and the checking that roads have been built to the design and to the specifications according to global health standards. But the minute we say, okay, it's too big a problem to solve, then the people who are using the roads, that's you and I, then feel powerless. So I feel like the problem is really big because it can only be solved from the macro level, but also only be solved if people rally up and call the government to task on ensuring that roads are designed for people.
We've heard about the need to get the government involved to make sure that they are paying attention to designing roads that are safer, especially because in low and middle income countries there are 90% of the fatalities of road traffic accidents. So one of the things that one would want to know is, can we say that the poor design therefore is a direct result of human error?
I would say yes. So when there's road accidents, many times it's because the person driving the particular vehicle and this is the fastest moving vehicle on that particular incident, has made a mistake of some kind. And there are very many scales of mistakes, all the way from sort of self-inflicted, which is driving under the influence of drugs or alcohol, all the way to completely unpreventable, where you didn't see the other person and the other person came by so fast, or it was a blind spot. So the entire scale of human error, when the person behind the wheel, sort of something happens and they don't feel like they're able to control the vehicle, and an accident happens. So that's the human error scale of accidents. And many times we sort of blame either the car, or the car has this issue, it was not maintained well. And those are all valid reasons. Or it was one of those cars that it's just not safe for the road, it was too old, etc., etc. There are all those factors. Or then there's the people who blame the human. And that's also very valid. I mean, there's some things that could have been prevented, could you see properly? Did you have your windscreen wipers if it was raining? Were you checking, your speed? Were you under the influence? All those things are human error. But if we make sure that the means by which we are moving this very fast instrument, which is the car, basically controls these human errors. To give an example, around many school districts in Kenya and also around the world, you must have road bumps to slow the car down, because children are about to pass and children are a bit erratic and children are a little bit, even in residential areas, you slow the car down in a way to ensure that it doesn't matter how, many errors the driver behind the wheel makes. It doesn't matter whether, the car is not in good shape, the human in the car is not in good shape. A bird flies from the left and smacks the windscreen and confuses everyone. The road is designed to slow you down enough in critical areas and in critical places so that you do not cause an accident, so that some of these accidents are preventable. So the answer to your question is that human error and also sort of like the mechanics of the car are just one part. The other part is how the road is designed. So my main area of interest in research is the fact that everywhere around the world, including areas where roads are quite safe, there are still places called hotspots, basically places where accidents repeatedly occur. And if an accident happens in the same place for the same reason anywhere more than once, it means that there's an issue that's not human error, that's not the car. It means that there's an issue that is based on the design of the road. And the minute that happens, the minute a second accident happens in the same way, in the same place, for the same reason, it means we need to look at how the road has been designed and prevent that from happening. All of this needs to be cataloged so that other blind spots or hotspots can be evaluated and redesigned to consider how to prevent preventable accidents. So some examples of this are, as I said, we think about it in school and residential districts, that we need to slow the car down. This area is a slow neighborhood, but every single road has a fast area where the cars are moving quite fast, and then there's also a slow area because cars are not the only users of the road. So on either side of the road, there are pedestrians, there are cyclists, there are two-wheeled vehicles, there are three-wheeled vehicles, especially in our case. And there are animals, there are pets, there are livestock. There's very many users of this thing that we call the road. But most times it's designed exclusively for the vehicle. And the vehicle, even most of the time, especially in the Kenyan context, is not actually the majority user of the road. It's actually used more by people on two legs, on bicycles. Those are the majority users of the road. But it's not designed for that. And so, of course, the safety aspect gets put into play. And if we do not consider the design of our roads to consider or to think about the slowest users of that particular road, then human error will immediately expound and cause preventable road accidents. So in summary, I know I've said a lot, is that there's different reasons accidents happen. And the majority of this is the fact that roads are not designed to consider humans. Not just the human behind the wheel, but the other humans using the roads.
As you were describing that, we can, anyone who's been in a major city on the continent can immediately see one of those roads where you have, at the same time, you have cars, you have your bikes, you have your three-wheeled bikes, or you have your pedestrians, children, even animals, and it can be a bit of a chaos sometimes. Would you say that it's all doom and gloom on the continent, or do we have people we can look up to in terms of road design in Africa?
I can't say from my own experience directly, but I will say that there's still towns and cities that are still very pedestrianized or pedestrian friendly. And I would mention, for example, Old Town in Mombasa or Old Town or Stone Town in Zanzibar. I mean, we've known how to design roads for a very long time. And that's another passion of mine, sort of looking back at the origin of spaces and design in the African context before we were westernized, to question how did we go so wrong. And we know how to sort of design for the livestock, design for the children, design for the people, design for the two-wheeled, the three-wheeled, the four-wheeled. And the idea is that the way that we design our cities should factor in that there's fast areas, but the majority of neighborhoods and zones need to be just slower. Also, we tend to forget that cars, because they move much faster, they can go a longer distance to get to where they go. We really want to make cars, we really design our roads in a way that cars are the most efficient. Cars can, try to make it super convenient for the car. But in my view, if I need to go an extra length just to make sure that the road is safe, that I need to go a bit slower because I need to put there some bumps or some rubber strips or some bends to slow me down, I think that's okay. But many times we sort of say, no, let's make it efficient for the car. Let's save money. Let's be efficient because that's sort of like the speed we want our cities to be in. So I can't say definitively I've been to a place where the city has good roads, but I can say that there are towns, much smaller towns, which are still embrace the pedestrian culture and try to enhance it right now.
Well, that's definitely positive. I am definitely interested in you speaking about the history of road design on the continent, and the fact that, interestingly, we've had the experience of road design on the continent for a bit. So that is surprising and reconforting, I guess. So it's just up to us to go back to that history, learn from that history, and make sure that we make changes that will save people's lives. So much of the safety measures are already in place in other countries, but why are they not necessarily included when roads are being designed?
It's a good question. The reality is that we have really good road designers. I mean, I have seen the layout plans for many of the roads in Kenya, and the section lines and what is included, what are the functions, what are the different zones. And many of them are really well done. They have the carriageway, they have the space for the services, that's the power lines, the sewer lines, the Wi-Fi, they have that space, which is the carriageway, the service way. Then they also have a cycle lane, and then they have the cycle lane protecting the pedestrian walkway, and then they have a curb, then they have some vegetation before you get to the wall or to the sort of the space to enter another road or another plot or another district. So all of these roads have these plans and these drawings, but what usually happens is that you start, especially in Africa, you start with the road, and then at some point something happens. There's a construction variation, there's a cost increase, there's prices of this have gone up. So the money or the budget allocated for these other, in brackets, is usually accidentally used up, and then it's sort of what the contractor or the people sort of making the big decisions decide is that, okay, we will do this later. Let's just open the road. Let's decongest the city. Let's just focus on getting the road working and moving, and we will put the pedestrian pathways and the cycle lanes and the safety bollards and the bumps and the even lines to divide the road later. We'll do that later, because the budget's run out. Something has happened, and that's what that's the context of where we are now. Even where I'm standing right now, I can see a road that was probably done maybe 15 years ago, and the pedestrian pathway still has not been done, because that conversation happened, and then by the time you're coming back and doing a tender, the contractor has left and said it's okay, let somebody else do it, and then you bid, and then it's too expensive, and the person said, okay, it's okay, then the political movement changes. So we are at the mercy of policymakers and politicians when it comes to roads, because as civilians, we most of the time we're not even allowed to do our roads ourselves. We're not allowed to put the pedestrian pathways, and it's usually too expensive because the pedestrian pathway crosses beyond many people's plot lines. So it has to be a communal effort, and that's why it's a government's mandate. So for all intents and purposes, roads are typically designed well. Typically, as I said, I can't speak for all roads, and not even considering that, even if it's not designed well, there's just general expectation that when you build a road, you need to work out where the people are going to walk and cross. But when the money runs out, when everything becomes heated and steel prices go up and things happen, these are the first things that come off the list or are shelved for much later. And somehow the road still opens. Right now, we've just completed the expressway, and then underneath our expressway that's going over our city, Nairobi, there's Waiyaki Way, which is an older road, and there are many sections of the road where they've added or expanded or widened the road. And up till now, we have been using this road, the expressway and Waiyaki Way underneath, with no markings. Forget there's no pedestrian pathway on either side or cycle lane, so it's super dangerous, and there's huge trenches that have been built. But there's currently no marking. So even as a driver, I don't even know which lane I'm in. So of course, the extension or the expansion of human error increases. So road design is not as complicated as it sounds. As you've said, in other countries, these standards have been set in developing nations. In Africa, most of the time the road design has some of these standards already in place. Like how wide if this road is 60 meters, how many times should you have a pedestrian overpass? What is the width of the cycle lane? You need a ramp up for the disabled access and a stair up for quick access. Like, these standards are set, and you can see that there's examples of these in many of our roads in Africa. But the sequence of events that leads a road to be opened just because it's ready for the car but not ready for anyone else is the question I'm putting into place. The second question, or the sort of thing that also prevents road safety, is the fact that when we do design some of these aspects of road, of the stuff that's not where the car will pass, many times we consider those the space that other things are using that is not the majority function of the road. And I believe it should be the other way, that we have to design pathways and cycle lanes, and then we can think about the car, because those are the ones that majority of people use and a majority of road accidents happen. Well, in summary, I just want us to really think about how we can make our road designs more human-centered, about the people who are using the road. Not just behind the wheel to prevent human error, but also the people who are walking, who are selling. Like, there's some nuances in the African context that we can't just ignore. We can't just pick a road plan from China and adopt it here. The population dynamics, the market sort of sensibility that people have on the roads need to be also factored in. When it comes to the laws and policies in place when it comes to safety, not road design safety, but just safety of the people using the roads, which include, for example, requiring to wear a helmet when you're on 2-wheel or 3-wheel vehicles. And also, if you are in a vehicle, you have to have seat belts, and as well as just all the safety measures that are put in place to ensure that if an accident occurs, you don't get too much damage. So these, I classify these as post-accident prevention mechanisms. So when an accident happens, these are there to help you to not get into too much damage. And the reality is that in the Kenyan context, it's a matter of corruption. So you can basically get away with anything on the roads as long as you're able to talk to the policeman nicely, including not wearing a belt, including not having a helmet. And I can speak about this, but I think it's one of those things, it's like a different policy issue, because for me, the road safety design that I'm talking about is accidents which happen and are preventable, and the people get injured even when they have a belt and even if they're following all these other protocols. But as you said, I think it's a very valid point. There are countless deaths that happen just because people either don't follow, and the reason they follow is that they can get away with it. And even when they don't follow, there's no enforcement to ensure this. In our context, in Kenya, for example, there's a lot of political waves. When the new cabinet secretary comes, he gets very excited. He makes all the policemen check everything. And then eventually people sort of get the wind of this, and they sort of see how they can navigate and get away with it. And then they sort of relax on that mandate, and then they come back again, another cycle. So like we've had very many sort of laws where they sort of said if you don't have a seatbelt, you can't enter the city. If you don't have a helmet, like recently with the borders, you can't do X, Y, and Z. And then people get very excited and they follow because of fear, and then it just dies away. So, and I feel like that's the same in many countries. If there's no enforcement, you feel completely unmotivated about how to follow them, especially when they do with their own safety. So the kind of impact I've had in road safety advocacy is primarily through the written works that I've done, as well as through the BBC documentary. Policy introductions, not yet. The BBC documentary came out just a month ago, so it's just sort of getting traction. And as I said, the issue, I'll sort of, there's many different threads that are connected to even one or two deaths on in any road accident. One is the vehicle itself. Has it been maintained well? Has it gone through the proper checks? Is it, has it been serviced properly? Does it have all the required sort of checks to make sure that it's roadworthy? So the vehicle itself, human error, I'd mentioned those different scales from, were you looking at your phone? Were you under the influence? Did you even see where you were going? Were you even in the right lane? Like so many human error aspects. And then, so the vehicle, the human error, then you have the road design, which is sort of like the thing I'm beginning to question and discuss and force policy to sort of impact. And then beyond that is like, how do all the different roads and infrastructure work in the different zones in the city? Because you can't also have bumps in the middle of a highway. That also causes accidents. So there's some situations, some macro level situations where cars should not be slowed down because they cause more accidents. In other cases where the cars must be slowed down because they cause less accidents. And in many cases, it's a lot to do with the human vehicle interchange. So at what speed is this vehicle interacting with a slower moving person or slower moving vehicle? And if that distance between the speed of the fastest moving item, like the car, and the speed of the person walking, for example, is too high, then there has to be either a change, so we're not walking on the same plane. So you have a pedestrian overpass, or you have an underpass, or you have, like, you should not be in the same sort of level. I'm not at all advocating that all cars should be slowed down on every single road, but that we need to consider the distance. We need to consider the difference between the fastest moving element on the road and the slowest moving element on the road. So, for example, if the car is moving at 120 kilometers per hour and the slowest person on that road is maybe a toddler moving at much, much less speed, then it means that they should not be on the same plane. you need to change the different planes that they're working on. And that's when you introduce pedestrian overpasses, guardrails to prevent people from trying to cross the road. You need to have underpasses. And in some cases, the road just has to be that fast, because if a car is going at 120, 130 kilometers per hour and you suddenly slow it down because of a pedestrian and you just put one or two bumps, then of course the car wouldn't slow down fast enough. The car behind it, it also causes accidents, because this road or this highway, or for example, the Autobahn, for example, has a certain speed requirement. So you change the plane, you make sure that they're not moving at the same plane. But if there's any situation where they are at the same plane, you need to look at the distance or the difference between those two and slow the car down so that there's the human error, vehicle error, and the way that the road is designed does not affect this. So all those four facets, the macro planning, the road design at a sort of more site plan level or more intimate level, all the way to the human area and to the vehicle, are all different policy considerations, all above sort of corruption, all above tenders that don't complete, or projects that complete halfway or run out of money, and then the sort of parts that are ignored or told to be done later, are all connected to a much wider discussion about how road or infrastructure projects are implemented. And so we've not started yet, but we're gearing up to sort of begin that policy conversation.
What are some safety measures that can be implemented to save lives?
So, as I'd mentioned, road design principles and road safety have been really well thought out. And there's many examples you can see, especially in Scandinavian countries where the majority of the population cycles to work. So they favor that sort of speed. And they've really redesigned their roads. So they had unsafe roads and they redesigned them to be slower and safer, especially at neighborhood levels. I'll list about 7 principles that we can implement to make our roads safer. One is to have speed classifications for different neighborhoods. The same way we sort of say schools have to be at this speed, residential neighborhoods have to be at this speed, but I think streets between offices, there's much smaller or minor streets within commercial areas. Let's also classify whether they should be a certain speed or slow or fast or medium, and then design for that. Even in long distance travels, when you're passing towns and villages, let's also classify what is the speed the car should be going in, and not just adopting bumps. Bumps are great. Rubble strips and bumps are effective, but also how can you design the road to sort of slow down in a more gentle way, which is like a bend, a turn, a curve, that's not causing a blind spot, but that also just forces the driver to sort of begin to slow down before they enter certain slow zones as well. Another principle that I would mention, and I've mentioned it before, is the difference in planes when considering the distance or the difference between the speeds of the fastest and the slowest vehicle. And there's different ways of considering these planes. It's not just the pedestrian must go up. Sometimes maybe the vehicle must go up. Maybe sometimes the vehicle should just not cross this particular road, especially if it's going too fast. So not being afraid to make it a little bit more inefficient for the vehicle so that you can favor the pedestrians or the slow moving elements of the road, which for the most part are the majority. At a macro level, it's important for us to consider how we plan our city blocks. We're all beginning to sort of see the value of sustainable design and environmental design, which is my passion as well. And we have seen sort of like the declarations of cities such as Paris, who are saying, let's do the 15-minute cities, making walkable and connected neighborhoods. And this is, again, how we used to live in African traditional cultures. You had your sort of market center, and it was all walkable, all reachable. Yes, you had your much more bigger sort of tracts of land that are a bit more sparse, but the city and the market centers were walkable, was connected, and very mixed use, so that you can get everything you need in a sort of short walking distance from your residence. And adopting this philosophy of smaller blocks, sort of shorter streets, and sort of neighborhoods that are, and not shorter streets for cars, but shorter streets for pedestrian pathways and connectedness, will not only make the streets safer because you'll have sort of blocks and zones that are pedestrian only. It will also mean that the vehicle itself sort of has very designated areas, and are so much more efficient. And it means that people will park their cars, they'll walk, that's healthier. The streets wouldn't be filled with smokes and exhaust fumes, and not filled with cars as well. And people will begin to interact at that ground level with shops and commercial entities, which is how we like to experience cities and spaces anyway. So embracing at a macro level shorter blocks, shorter systems, and compact planning within the larger cityscape. As I said, we're not going backwards, we're just working out how can we improve our current systems. So I've mentioned 3, and I'll just mention one more, and it is at all times realizing that humans use these roads, humans use these vehicles, humans are the ones interacting with these things. It's not a mechanical thing. It's not all about engineering. Let's think about the psychology of the human. How will they drive on this road that's a downhill and a bend, and how are they going to use this road? Of course, as they're going downhill, they'll speed. So what do you need to do? How do you need to intervene to prevent an accident? So humans use these roads, and so we need to think about the design and the space as humans, including the vehicle itself, the road itself, the macro planning considerations, and all that. So I think I'll leave it at that. But there's very many more, and I can share more, or you can read some of my work to learn.
Thank you so much. If we are going to remember anything from this talk, it is that there are 7 really good road principles that can help us save people's lives. And so one road safety principle a day keeps the road fatalities away. We're going to share a link to Etta's works, whether that's the BBC documentary or the op-ed, so that if you want to learn more about these principles, about her work, you can do that and you can connect with her. Thank you so much for making the time for us today. Thanks for sharing your expertise. Thank you.
Thank you for having me.